All right, good morning and thank you for joining us for this month's Policy Update webinar. I'm Trevor Rode, one of the Provider Relations Specialists with the Office of Medicaid Policy and Planning. I'll be walking you through all of the policy updates from October 3rd through October 31st, 2023. As we go through the updates today, please hold any questions and we will address them individually at the end. Updates today will be broken into newly covered services, claim adjustments, policy updates, reimbursement updates, and news announcements. So with that, we will get started. Let's start with newly covered services. We have a few to review today, one of which is COVID related. In BT 2023-144, the IHCP announced that it would be covering the administration of CPT code 90677, effective for dates of service on or after April 27, 2023. The US FDA expanded the allowable range for the Prevnar 20 pneumococcal conjugate vaccine to the pediatric population. This code is for intramuscular use for members 6 weeks and older. Any claims with dates of service on or after April 27, 2023 that denied an error will be reprocessed. This vaccine is available through the Vaccines for Children program, so when administered to members ages 6 weeks through 18 years, IHCP reimbursement is limited to the administration fee only. Effective for dates of service on or after June 22, 2023, due to vaccine availability through the VFC, the IHCP reimburses PVC 20 vaccine at $0 for members ages 6 weeks through 18 years. PA and National Drug Code are not required, and this code has a quantity limit of 1 dose per member per lifetime for ages 6 and older, and a quantity limit of 4 doses per member per lifetime for ages 6 weeks through 5 years, as recommended by the Advisory Committee on Immunization Practices. The updated code range will be reflected in the next regular update to the professional fees schedule. For more details, please refer to the bulletin. In BT 2023-147, the IHCP announced it has modified the claim processing logic for services covered by Medicare but not covered by the IHCP. In BT 2023-13, the IHCP began enrollment for Medicare-only providers, which is Provider Type 37, Specialty 370, that serve duly eligible members, and this was effective March 30th, 2023. These providers are only eligible to receive reimbursement for any applicable cost-sharing obligations for duly eligible IHCP members. For QMB duly eligible members, the IHCP will reimburse a member's Medicare coinsurance and/or deductible amount for IHCP non-covered professional or outpatient services. Providers will see EOB code 80885, which is provider payment of coinsurance and deductible for non-covered services on impacted claims. This logic impacts all IHCP providers, but all remaining claim processing logic for duly eligible members remains the same. Our next newly covered service comes from BT 2023-148, where the IHCP announced it may cover weight loss medications for eligible Medicaid members under the age of 21 through the Early and Periodic Screening, Diagnostic, and Treatment Program. The 2 FDA-approved drugs that may be available for an EPSDT eligible member with an approved PA are Wegovy and Saxenda. KeyPro will review PA requests for these medications to determine medical necessity. These requests must be submitted using the generic codes J3490, J3590, and C9399, but it is imperative that the specific drug name be chosen in the associated questionnaire in the Atrezo Provider Portal or clearly listed on the faxed PA form. Determination of medical necessity for these medications will be on a case-by-case basis using peer-reviewed literature. Member needs and clinical assessment will be taken into account during the review. PA requests should include a diagnosis of morbid obesity with comorbid conditions and documentation of nutritional counseling and/or weight loss programs and any pharmacological agents or interventions that have been used by the member. Reassessments of medical necessity for continued authorization will occur every 6 months. Upon authorization, the prescriber may submit the prescription through the normal pharmacy ordering process. The MCEs will establish and publish reimbursement PA requirements, and billing criteria within the managed care delivery system. The finally newly covered service that I'm going to mention is COVID-related and comes from BT 2023-142. The IHCP announced it would be reimbursing enrolled providers for the Pfizer and Moderna COVID-19 vaccine codes for the ages indicated in the table within the bulletin, and would cover the HCPCS code J0174, which is an injection treatment for Alzheimer's disease. The COVID-related codes are effective retroactive for dates of service on or after April 18, 2023. For the Alzheimer's code, it is effective retroactively for dates of service on or after July 6, 2023. The claims processing system has been updated for both the COVID-related codes and the Alzheimer's code as well. These codes will also be reflected in the next regular update to the professional fee schedule and the outpatient fee schedule. For more information on the specific codes, please refer to the bulletin. Next, we will move on to claim adjustments, which we only have one to cover today. Excuse me, two. Oh, sorry, I forgot to change the slides there. In BT 2023-137, the IHCP identified an issue where claims may have denied incorrectly for some rendering providers submitted on claims. Claims may have been denied in error when rendering providers had a new IHCP provider ID created. These claims may have denied with EOB 1004, which is rendering provider not enrolled at the service location submitted on the claim for the program billed for the dates of service. Please verify provider number and service location and resubmit. The claim processing system has been corrected, and claims that denied an error for EOB 1004 will be mass reprocessed, and these reprocessed claims should be seen on remittance advices starting November 22nd, 2023, with ICNs or claim IDs that begin with 80, which is reprocessed denied claims. Our final claim adjustment was announced in BT 2023-138, where the IHCP identified a claim processing issue affecting certain fee-for-service claims billed for the continuous glucose monitor procedure codes A4238, A4239, E2102, and E2103. Claims may have denied incorrectly for EOB codes 0217, 1012, 2033, 3930, 4013, 4021, 4218, or 4801. Claims also could have paid inappropriately without an NDC reported on the claim. These professional or outpatient fee-for-service claims submitted between January 1st, 2023 and September 15th, 2023 may have processed incorrectly and will be mass adjusted or reprocessed. The claim processing system has been corrected, and providers should see adjusted or reprocessed claims on remittance advices starting 11/22/2023, with ICNs or claim IDs that begin with 52, which is mass replacements non-check related, or 80, reprocessed denied claims. Please refer to the bulletin for more information. We will now move on to important claim policy updates, which we have a few of. In BT 2023-130, the IHCP updated transplant guidelines for colon cancer and urine drug screening. Effective November 2nd, 2023, screening requirements were updated for the following: lung transplant, heart or lung transplant, kidney transplant, liver transplant, pancreatic transplant, intestinal transplant, multivesicular transplant, bone marrow, or stem cell transplant. And the updated screening requirements for the listed transplants are as follows: appropriate screening for colon cancer if the member is over 45 years of age, and urine drug screen based on the physician's discretion. Documentation of the screenings must be maintained in the member's medical record and submitted with the PA request. The next policy update comes in BT 2023-136, where the IHCP announced updates to PA and expanded criteria for home oxygen policy. These changes are effective for dates of service on or after November 20th, 2023, and the changes are as follows. Removed policy language requiring that indications for oxygen needs must be based on a member's assessment being conducted during a chronic stable state. Created a distinction between termed oxygen user and a lifetime oxygen user, and expanded indications for oxygen coverage to include certain Group 1 criteria. More details on these changes can be found within the bulletin, and the IHCP would also like to remind providers to refer to the IHCP Provider Professional Fee Schedule for coverage and PA requirements for applicable take-home oxygen supplies and equipment. All oxygen supplies and equipment require at minimum an initial PA, and the fee schedule will be updated to ensure this is reflected. In our next policy update, the IHCP updated the ICD-10 procedure codes for hysterectomy, effective on dates of service on or after November 27th, 2023. The ICD procedure code 0UT70ZZ has been removed, and updates will be made to the ICD-10 procedure codes for hysterectomy code table and obstetrical and gynecological services codes. This ICD-10 PCS code remains included on the list of codes that always require a consent for sterilization form or documentation of allowable exception as described in the IHCP banner page BR 2022-24. Providers are obligated to obtain informed consent and submit the consent for sterilization form for any service that is performed specifically to sterilize a member, including services not listed on the aforementioned tables. In BT 2023-140, the IHCP updated school nursing services effective for dates of service on or after July 1st, 2023. Coverage has been provided for nursing services rendered by an RN or licensed practical nurse who is employed by or under contract with an IHCP-enrolled school corporation provider. Covered services must be medically necessary and pursuant to a Medicaid-enrolled student's educational program or plan as described in the bulletin. Rates for school nursing services are within the bulletin, and there is also a clarification for the use of modifier TM for school corporation services, which was originally announced in BT 2023-56. The IHCP continues to require school corporations to bill all covered services with modifier TM, which is Individualized Education Program. Modifiers TL, which is Early Intervention Individualized Family Service Plan, and TR, School-Based IEP services provided outside the public school district responsible for the student, are not to be used when billing school corporation services to the IHCP. In BT 2023-143, the IHCP announced updates to the age restriction for the ICD-10 CM diagnosis code Z00.01. Retroactive to September 30th, 2022, the age restriction for Z00.01 is updated to ages 15 and older. BR 2022-35 updated age restrictions in core MMIS for reimbursement of claims submitted with diagnosis code Z00.00 for members 15 and older. After a further review, it was determined that the age restriction should also include the encounter code for abnormal findings Z00.01. This will apply for fee-for-service with dates of service on or after September 30th, 2022, and any claims that may have denied an error will be reprocessed. Providers should see adjusted or reprocessed claims on remittance advices beginning November 29th, 2023, with ICNs or claim IDs that begin with 80 or 52. Our final policy update comes with BT 2023-146, in which the IHCP announced pharmacy updates approved by Drug Utilization Review Board at its October 20th, 2023 meeting. The IHCP enhanced its automated PA system to update criteria for the multiple sclerosis agents, and these PA changes will be effective for PA requests submitted on or after December 1st, 2023. PA criteria for non-SUPDL PA and step therapy and Skyclarys were established and approved by the DUR board and applied to the fee-for-service benefit. These will also be effective for PA requests submitted on or after December 1st, 2023. There were also updates to the OTC drug formulary established at the meeting. For more information on those updates and the other updates, please refer to the bulletin. So we now move on to reimbursement updates, which we only have two to cover today. See now that there's only one listed on the screen, so that's unfortunate. In BT 2023-141, the IHCP announced that CMS has approved the HCBS waiver rate increases, which are retroactive to July 1st, 2023. These rates will apply to the Division of Aging, Aged and Disabled Waiver, and the Traumatic Brain Injury Waiver, along with the DDRS Community Integration and Habilitation Waiver and the Family Supports Waiver. This was previously announced in BT 2023-59 and BT 2023-78. All claims processed on or after October 25th, 2023 will be paid based on the new rates if they have been billed with the new rates. Providers will receive updated service authorizations or notices of action for each waiver that recipient that reflect the new rates. The timeline for mass adjustments on previous claims that need to be resubmitted, and waiver service changes can all be found within the bulletin. So our final reimbursement update came in BT 2023-135. CMS released new federal hospice rates for federal fiscal year 2023, effective for dates of service October 1st, 2023 through September 30th, 2024. These rates are the basis for payments to Medicaid-enrolled hospice providers. The total per diem amounts reimbursed to the IHCP enrolled providers are calculated according to the IHCP hospice members level and location of service as follows. Routine home hospice and private home, IHCP hospice per diem only. Routine home hospice in the nursing home, IHCP hospice per diem plus room and board per diem. Continuous home hospice in the private home, IHCP hospice per diem only. Continuous home hospice in the nursing home, IHCP hospice per diem plus room and board per diem. Inpatient respite care for the private home members or nursing facility members, IHCP hospice per diem only. And general inpatient care for the private home members or nursing facility members, IHCP hospice per diem only. This bulletin also dives into more detail about the hospital per diem rates, along with the tables showing the federal per diem rates for hospice claims, so please reference the bulletin for this information. So we will now move on to our news announcements, which we have multiple to cover. First, in BT 2023-131, OMPP clarified the request for HIP MCEs to reprocess denied Medicare coinsurance claims. This was originally announced in BT 2023-94, but this clarification bulletin makes a note that this only affected Medicare coinsurance and deductible claims for members who became Medicare eligible during the PHE and were members of both Medicare and HIP for dates of service on or after March 1st, 2020. Providers serving HIP members, including FQHCs and RHCs that submitted claims for coinsurance and deductibles using procedure codes that did not match the codes on Medicare remittance, will need to resubmit corrected claims to the MCE for payment. Timely filing will be waived for 90 days from the date of this publication. For our next news announcement, in BT 2023-132, the IHCP announced COVID-19 vaccine pharmacy benefit updates for the 2023-2024 season. The US FDA announced the approval and authorization for emergency use of updated mRNA COVID-19 vaccines formulated to more closely target circulating variants on September 11th, 2023. Effective for dates of service on or after September 11th, 2023, the IHCP will reimburse IHCP-enrolled pharmacies for the updated 2023-2024 Moderna and Pfizer COVID-19 monovalent vaccines and their administration when given to applicable IHCP members as approved by the FDA or authorized for emergency use, and recommended by the Advisory Committee on Immunization Practices of the Centers for Disease Control. Pharmacies that submitted claims for these vaccines with dates of service on or after September 11th, 2023, but prior to this publication, may reprocess the claims to be reimbursed for the ingredient cost. Additionally, effective for the dates of service on or after October 1st, 2023, point-of-sale pharmacy claims for COVID-19 vaccines should no longer be submitted using Service Clarification Code 420-DK for reimbursement. Vaccines administered by the pharmacist should continue to be submitted with a professional service code which is 440-E5 of MA to receive an administration fee. There is a table you can reference within the bulletin along with more information on the vaccines. In BT 2023-133, OMPP and the DFR announced a new email box has been created for nursing facilities and other providers to use to notify the DFR a deviation request and documents have been mailed for timely processing. Providers should email DFR deviation requests at fssa.in.gov to notify the DFR that a deviation request has been requested. Please do not send documentation via this email inbox. Verification documents for the deviation request will still need to be mailed to the Document Center at FSSA Document Center with P.O. Box 1810 in Marion, Indiana, zip code 46952. The DFR wants to remind providers that documentation of the medical expense must include a provider-generated bill or a copy of such a bill, which includes the dates of service and type of service and clearly shows the amount that the member owes after any third-party payment. Providers also will not receive a response to the email notification sent to the DFR deviation inbox. In BT 2023-134, the IHCP and KeyPro reminds providers to use correct NPI and provider IDs on PA submissions. They also remind providers to select the group or billing NPI as the servicing provider when submitting a PA request rather than a rendering provider's NPI. Selecting an expired IHCP provider ID and NPI combination or selecting the incorrect NPI will result in the same error message, which is provider is not currently eligible to provide service during the requested time frame. For any questions, please refer to the bulletin for contact information for KeyPro. In our penultimate news announcement, BT 2023-145 announced the date for full enforcement of EVV for personal care services. The original bulletin for this subject was BT 2018-55. The requirement that personal care services providers use an EVV system has been in place since January 1st, 2021. Beginning November 15th, 2023, and continuing through December 15th, 2023, the IHCP will temporarily turn on EVV system edits that activate claim denials for non-compliant EVV personal care services. Claims will be denied during this time period for non-compliant EVV claim submissions. On December 16, 2023, the FSSA will temporarily turn off edits for claim denials to allow providers to identify errors in their EVV processes and system that may have occurred during the temporary activation and correct outstanding issues before turning on the final edits. The final EVV edits will be activated in April 2024, consistent with federal requirements. In the coming months, the FSSA will be hosting multiple opportunities to answer questions related to EVV and support for providers as they integrate this technology into their practice. This bulletin also provides details on the EOB codes related to EVV, along with the EVV pre-check process. This is important information for providers to review. Our final news announcement comes in BT 2023-149. The HIP rate equalization project is underway to equalize provider reimbursement across all Indiana Medicaid programs for physician and ancillary services, effective January 1st, 2024. BT 2022-77 initially announced this new reimbursement model. The IHCP professional fee schedule will now be aligned with 100% of Medicare rates. Hoosier HealthWise, Hoosier Care Connect, and fee-for-service programs will all be increased to 100% of Medicare rates to align with HIP rates. HIP rates for 2024 will remain the same as rates paid in 2023. The 2024 professional fee schedule will be implemented as a minimum fee schedule for all managed care plans, and managed care entities will be required to reimburse providers at or above the fee schedule rates for services covered under the member's benefit plan. The IHCP has created 4 fee schedules showing the new reimbursement rates for physician services, DME and medical supplies, NEMT, and dental services, and these can be accessed at our fee schedules page at in.gov/Medicaid/providers, and the rates will be updated in January 2024 to reflect the updates on these 4 preview documents. More details on these specific updates can be found within the bulletin. These are the bulletins we discussed today and each article included. All of these can be found on the provider section of the Indiana Medicaid website. So I'll stay on each slide for a few seconds. So I'd next like to take just a couple minutes to go over the resources we have available for providers and ways that you can reach us when you have questions. When you have questions or concerns, you can reach out to your regional field consultants. Each MCE in Gainwell Technologies has representatives assigned to each area of the state. They should be one of your first points of contact when you have questions. Our provider reference materials can be found on the IHCP provider website. These materials include our bulletins and provider reference modules. These will keep you up to date with all of the new information coming from IHCP. The Provider Education tab on the provider website provides information on all of the different trainings, webinars, seminars, and other education opportunities available to you. If you are not yet receiving our weekly emails that introduce our provider communications, please go to the provider website and scroll to the bottom where you'll see a box just like this. Enter your email address and you'll be signed up to receive an email each week with links and summaries of the bulletins and other provider communications. If you have reached out to the customer service teams and the regional field reps of the MCEs or Gainwell Technology and continue to have questions, you are always welcome to reach out to the provider relations team with OMPP. We are available to you as well. You can reach out to us via the OMPP provider relations email on the screen. The IHCP Listens inbox is another way you can reach out to us. This inbox is specifically for us to receive feedback on our presentations, outreach, and education opportunities, and to let us know if there is a void in the information we are giving to the provider community. I think of the two email boxes this way. If the answer to your question is specific to you or your facility, email the provider relations inbox. If the answer to your question would benefit the entire provider community or everyone in your provider specialty, send those questions to the IHCP Listens inbox. And if you have questions about provider enrollment, you can always reach out to my colleagues at the enrollment email address on the screen. So this time, we are happy to answer any of your questions. Please go ahead and type your questions in the chat box and we'll address them one at a time. We don't have the appropriate subject matter experts available to you right now. We will take your question back for research. We may ask you to send your question to the OMPP Provider Relations inbox so we can send the answer when we have it ready. And I do have one final request for you to take this survey. We care about your feedback so much. We want to hear about it, about this webinar too. How can we better provide information to you on a monthly basis? Again, scan the QR code or click the link I'll be putting to the chat now. But yeah, I just want to thank you for your time and for being an IHCP provider.